Hi, I'm Molly Brennan from the University of Michigan Flint. I work in public health and health sciences there. But I also wanted to let you know that I've been involved. I haven't just been in academia. I've also worked for Blue Cross and Blue Shield of both Michigan and North Carolina. And some of this was relevant when I worked there. They had just started talking about it and trying to integrate it into different practices. And I'm also serve on the advisory committee at the University of Michigan Hospitals. It's called Impact Program. But basically, we're looking really closely at discharge planning, and they're trying to decrease the amount of readmits within the hospital. And they're finding that a lot of people are being discharged from the hospital and then coming back in because they're not having complete discharge plans for their families and the caregivers of folks that are being discharged. So with that, I'm just going to jump into the patient-centered medical home, which I'm sure you're all familiar with at this point in time. And then I wanted to, towards the end, I wanted to see where you're at with it and what you're looking to do in the future with the model, if anything. But so I just wanted to do a kind of a review of the patient-centered medical home. It's a care delivery method whereby patient treatment is coordinated through their primary care physician. It could be specialty physicians as well, to ensure they receive the necessary care when they need it in a manner that they can understand. That's kind of a broad overview of it. Excuse me. The objective of the patient-centered medical home have a centralized setting that facilitates partnerships between patients, their physicians, and when appropriate, the patient's families or caregivers. Care is facilitated by registries, information technology, health information exchange, and other means to ensure that patients get the indicated care when and where they need it and want it in a culturally and linguistically appropriate manner. So there's 5 main components to the PCNH. The first one is comprehensive care. And it says primary care medical home and primary care physicians in here, but when I was also doing some additional research on the model, they were also talking about specialty care because obviously where you're working in the area of neurology. And there have been some models set up in specialty care as well. The PCMH is accountable for meeting the large majority of each patient's physical and mental health care needs, prevention and wellness, acute care and chronic care. Looking at comprehensive care, obviously you're going to be working with a whole team of providers, and this could include a wide variety of folks: physicians, PAs, nurses, neurologists, pharmacists, nutritionists, social workers, a variety of folks. Although some might bring together large and diverse teams of care providers, they will also build virtual teams linking themselves and their patients to providers and services in their community. Second is that it's got to be obviously very patient-centered. It's a relation-based, and it looks at the whole person, not just looking at a particular disease or a particular body part, but looking at the whole person. It's kind of a holistic approach. And it really revolves around partnering with patients and their families and creating a partnership and also doing some shared decision making. And this includes respecting patients' needs, culture, values, preferences. And this model actively supports patients in learning to manage and organize their own care at the level the patient chooses. Excuse me. And I like this quote from Dr. Maples, who's the ED of the Institute of Healthcare Excellence. We need to focus on the quality of our interactions with patients. Do patients feel truly cared about, listened to, and respected? Are we taking enough time to answer these questions? The most positive patient experiences arrive from workplace cultures that understand the value of the patient relationship, build teamwork, communication, and processes that strengthen our engagement. The third part is coordinated care. And when I was talking about some of the work I do at Michigan Medicine right now, this is a really big issue. We're finding that there isn't a lot of really positive coordination of care, or it's lacking, or the ball gets dropped a lot of times for referrals and resources once you are out of the acute setting or within the hospital setting. But we're also finding this with primary care as well, so that people basically know what they're doing when they need to make the transitions, or when they need to really self-manage their care at home. We're not, at least at Michigan Medicine, we're not doing an overly great job of that, because we're having some readmits when it's not necessary, because people aren't getting the kind of care coordination that they need. And so this seems like a big deal right now, especially in hospital settings. Accessible services, being available, shorter waiting times, enhanced in-person hours, communicating electronically through email, portal systems. Obviously, quality and safety is always important. I don't know why that became underlined. But always looking at, continuous quality improvement, using evidence-based medicine, and, being willing to share some of that data too. A lot of places now are trying to be a lot more transparent in terms of their quality levels. So that's another portion of the PCMH. And I'm assuming you do stuff around quality and safety all the time. So, gotcha. Do they work? The overwhelming literature is showing very positive results. Since the model has been around now for multiple years, we're starting to get some really robust literature. I just put these 4 down here. I just picked them out because I was looking through some of the evidence-based literature on it. They're finding that they save money, they reduce hospital and ER department visits, help with health disparities, and improve patient outcomes and satisfaction. So overwhelmingly, the literature is showing positive impacts from this particular model and utilizing this model. These are the best resources. Agency for Healthcare Research and Quality and NCQA in particular have all sorts of tools, resources, trainings, podcasts, materials that could be used, and there's no cost to these in terms of trying to set up more of a PCMH model, and there was just so many resources out there for it through these particular agencies that I was actually kind of overwhelmed by how much they have out there. So for additional information, these are the top 3 that I found have just incredible resources to build upon and explain better the patient-centered medical home. And I just wanted to open it up to questions and talk about, and you've already answered some of these, but where are you right now, and where do you see yourselves going with this model, or have you fully embraced it?